Hey everyone! So in this video we're going to talk about face muscles um, and where they all are. It's going to be pretty dense, but I've got some other resources after we cover the page in the book that might help you to be able to pull those apart and see them individually. So let's just go ahead and dive right in. Um, let's start with number one right here. It's going to be levator palpebrae, and that's basically your eyelid. So, looking at page 50 in your book, it shows 1 through 4 are all going to be um, different nerves, I guess, than the rest of them. So, 5 through 19. Um, so, number 1, that's going to be your ocular motor nerve that controls this. Number 2, let's go back up here. It's going to be your masseter. So 2 and 3, your temporalis, they're going to be controlled by cranial nerve number 5, which is your trigeminal nerve. Um, and then number 4, it's going to be your parotid gland, and then your parotid duct. And it's going to produce saliva into your mouth. You can see that duct going through that buccal muscle. So, looking at this, let's keep going. So, number 5 is going to be orbicularis oris. Number 6 is going to be orbicularis oculi. Orbicularis is kind of like just a muscle that makes a circle. Um, and then oris is mouth, oculi is eye. That helps you. Number 7 is your frontalis. And then you're going to have that aponeurosis, epicranial aponeurosis. And you get number 8 right here, which is your ocularis. Oh, not ocularis, occipitalis. It's going to be your occipitalis. Number 9, it's gonna, you got a label down here, but it's this muscle that's hiding kind of in the background, called your buccinator. Those are your cheek muscles. Uh, they're used for blowing and sucking. Um, it compresses your cheeks. Number 10 is going to be this nasalis right there. Flares your nostrils is what it's used for, really. Number 11, um, that is going to be your levator labii superioris. It's going to be this muscle right here. So it is going to elevate the upper lip, and it's going to assist with flaring those nostrils. Number 12 is this one right here. That one is going to kind of elevate those upper lips as well. So now we're going to look at number 13. Number 13 is going to be your zygomaticus major and minor. So right here, that is going to be B, and then that is going to be A. Major's A, minor's B. Best way to put it is put your hands up on the side of your face, and your index finger is going to be right here, and then your middle finger's right there. So putting it like there, like that on your face, you're going to remember like your minor is going to come before your major, where it connects in. So then number 14, we're going to have depressor anguli oris. That's going to be this one in yellow right here. And then you're going to have number 16 right here that's going to get you confused. That's depressor labii inferioris. Kind of like your 11 and 12, the labii lie more medial, whereas your anguli lie more lateral. So you get your levator, that's the action it does, labii, meaning lip, superioris. Okay. Now you get depressor labii, moving your lip, inferioris. Okay. Or, yeah, depressor labii inferioris. That's going to be like your pouting muscle. I forgot to mention that number 13, those muscles are used for smiling. Number 14, to see it one in yellow, that's depressor anguli oris, that's your frowning muscle. Number 15 in brown, hiding right there, that's going to be your mentalis. It's used to elevate and protrude your lower lip. Number 17 in green right here, this is rizoris. It helps with smiling, so it assists with number 13. 18, it's not on here. We'll have to draw this in. So these are your anterior, superior, and posterior auricular muscles. Auricular is another word for like ear. So these muscles move and wiggle your ears. So 18A is going to be right here for anterior, 18S for superior, and 18P for posterior. Okay. Number 19 is going to be your platysma. Platysma. It's like a thin covering. It covers all of your neck muscles, and it's a broad muscle. It's like thin, but it's very broad for sure, and it depresses the mandible. Also tenses your skin of your neck and lowers your face muscles. It tenses skin of the neck and lower face of your lower face. So there's that. There's all those muscles. Let's go through here. This is just another picture from another book. It gives you that look of the face muscles just head on. Frontalis, right? And then got our orbicularis oculi, levator palpebrae, and then this is your levator anguli oris. Zygomaticus minor, Zygomaticus major, buccinator, rizoris, I think is this one right there. Then we have depressor anguli oris, depressor labii inferioris, mentalis, and then your platysma right through there. Nasalis, orbicularis, oris. From another book, just so you can see these are what's called trigger points. Just where I'm a massage therapist, I pulled these pictures from a book that I used in another course. So the green dots represent if you have like a knot in this muscle, then this is like radiating pain that you'll receive. And some people receive migraine headaches having knots in these, as you can see. Information that we find right here pretty helpful as well. So you can see the insertion, the origin, the nerve that runs it, the action that it does, and basic function. So that's your masseter. Your temporalis muscle, these are radiating pain right here. Then the origin, insertion, the nerve, the action, mostly used for chewing food. Your scaling muscles, we'll cover those in the near future. But you have an anterior, a middle, and a posterior. Getting a knot in those usually causes radiating pain to come down into your hand and your arm. Some more information. The scalenes are mostly used for rotating your head. The nerves coming out of that cervical part of your spine. Here's your insertions of them and your origins. Your sternocleidoid mastoid also causes some migraines in some people, from my experience. Again, green dots are like where the knot could be and it causing those things. When it comes to opening and closing your jaw, if you're closing your jaw, you're elevating your jaw. Opening your jaw, you're depressing it. If you have like an underbite where your jaw is actually more forward than where your maxilla is, that's called a protrusion. Or you can even do this. You can protrude your jaw, move your teeth forward, or you can even retract them and move them backwards. So that's it for this video. So if you have any questions, leave it in the comments. Please like the video if it was helpful, and we'll talk to you later. All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nielsen and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.